welcome back to Body Beautiful. I'm Janelle Marie. We are talking to cosmetic surgeon Dr. Joseph Mealy about the latest in cosmetic procedures. Dr. Mealy, we started with gynecomastia, so let's go to the ever popular tummy tuck. Am I right? Still very popular, correct?
Very popular, yes.
Who's a good candidate for a tummy tuck, Dr. Mealy?
So we do these mostly on women, and often it's after childbirth, but also after weight loss.
Yes.
For both men and women.
A lot of people get the weight loss surgery.
Yes.
And they may have a lot of loose skin there, so obviously they're good candidates, right?
Yeah, because that loose skin, it's something that even if you lose more weight, it just tends to drop more. It doesn't shrink up very well. I mean, if you've just lost weight, you know, it's good to give it about a year and see how much recoil you're going to get. But after a year, if it hasn't kind of shrank back up, it's not likely to.
And then a lot of tummy tucks are performed in what's called a mommy makeover, correct?
Yeah, mommy makeover just means we're doing something to the tummy and the breast at the same time.
Got it. So you can combine those surgeries and then it'd be just fine.
You can, yeah.
Let's go to picture number one. We love the before and after photos. So what's going on in picture number one?
So this is someone who had a baby, and you can see the lower part of her abdomen is sticking out, even though she's in really good shape. She's not overweight. And that's because the muscle has dehisced. The center part of the muscle has come apart, and now you can't really suck that area in. If she tries volitionally, she can do it for a little while, but it's not something she can do for very long. So what I've done in surgery is get rid of that extra skin at the bottom, which had a lot of stretch marks in it, and then go up on the front of that muscle and tighten it just like a corset. So we're tightening it from the rib cage all the way down to the pubic region.
So of course, when we tighten it through the muscle, that's going to be a lot more recovery time, am I right?
That's why there's a recovery time for tummy tucks. The first couple days usually pretty sore, but most folks by the end of the week are feeling good, and by 2 weeks are back to doing what they want to. We do limit heavy lifting for about 6 weeks, because if you lift too much or do too much in that area, it may loosen up that repair, and then we've got a little bit of laxity, a little fullness back.
Let's go to picture number two. That's quite a change here.
Sure, and same thing here. On that first one, the incision was actually where you, right out where you can see it. On this one, the incision is a little newer, so you can see it a little bit more easily. It's a little more purpley red in that lower part. But the same problem, that lower part of the abdomen is sticking out because the muscle's been stretched. We can get rid of that. We can get rid of any fat that's down in that area and all the extra skin and just tighten it up and make it nice and smooth.
And a lot of people are worried about the tummy tuck scar, but you pretty much place it where it can be hidden.
The goal is to get it below the bikini line, so that if you're wearing something, even something revealing, you're covering that scar up.
And now, as we go to picture number three, can fat be removed when you're doing the tummy tuck, and can you put the fat in other parts of the body if needed?
We can, and people ask about that more and more these days. But this patient has a little more fat on her belly. So all that fat that's at the belly button level or below, it's attached to the skin we're removing, so we just remove it.
Gotcha.
So the fat that's high, so like on the sides, the flanks, or in the back, we can do that. We can do liposuction in those areas too. But the fat that's high on the flap, like above the belly button or just above the ribs, that's where the blood supply is coming for that skin. So often we will stage that. So we'll do the tummy tuck, and if there's a little fullness from that fat, wait about 3 months, then come back and remove it.
That looks great. And the stretch marks are gone, which a lot of women, they care about that after childbirth, of course, but a lot of those seem to be gone when you do this procedure.
Well, most of the stretch marks are on the lower part of that belly, which is the skin that's removed.
Right.
But the ones that are higher, the ones on the side, they're still there. Often they look better, though, because they're smoother and flatter.
That's wonderful. Let's go to the last picture, please.
Sure. So this same idea, we're doing tummy tuck, trying to remove extra skin, trying to reshape the body. And in this case, I've done a little more body sculpting with liposuction. And we may have done a little stuffing into the buttocks with that one too.
Yeah, because I can kind of see where the curve is a little more pronounced in the after picture, right? She's got a nice curve there.
Yeah, because of the before, she looks very rectangular. It's just sort of straight up and down. Afterwards, we're able to give her back some curves by taking away fat at the waist and adding it to the buttocks and the hip. So and certainly removing the extra in the belly too.
So if a woman wanted to do that, kind of a mommy makeover, a Brazilian butt lift, maybe a tummy tuck, and breast aug, she can do that all in one sitting there?
She can. It's a harder recovery.
Correct.
Because with just the breasts and belly work, you can lay on your back. When we do Brazilian butt lifts, we're adding fat to the buttocks. Can't really sit on that because it's going to damage the graft, so you're stuck on your side. And it's a little harder.
And when somebody comes in for a tummy tuck, do you put them out? How does that work?
Oh, absolutely. Yeah, I wouldn't want to try this one under local.
No.
So for this, it's under general anesthesia. I do it in a certified, accredited surgery center. The anesthesiologists know what they're doing. They're there just to take care of the patient, make sure they're safe. I also keep most of my tummy tucks overnight.
Oh, okay.
And that way we can make sure they're up and moving, they're not nauseous, able to avoid, go to the bathroom, all the normal stuff that we can do. I just want to be sure you're doing it all normally afterwards. And I think it really helps both in terms of comfort as far as pain, but also comfort in terms of feeling like you're going to get through it okay. Because by the next day, you're up walking, feeling better.
And real quick, do you have to do it again soon, or is a tummy tuck, one tummy tuck enough?
Usually once enough.
Oh, yes.
Especially if you do it after you're done having kids.
Exactly.
That's going to increase the chances.
I love that. All right. Thank you so much, Doctor. If you want more information on this, you can see the before and after photos on the websites drmealy.com, sanfranciscobreast.com, or you can call the doctor for more information, 925-943-6353. Keep it right here on Body Beautiful. We'll be right back.